I'm Ralph Baergen. I'm a professor at Idaho State in the philosophy program, and I want to tell you about a course I'm going to be teaching in the spring semester of 23. The class is Topics in Biomedical Ethics, and this time the topic is Ethical Issues Regarding the Opioid Epidemic. This course is taught every spring semester, and it's an opportunity to take an in-depth look at some current issue in healthcare and its ethical issues. Recent topics have been issues arising from the COVID pandemic and the ethics of medical research. This time it's the opioid epidemic, which is certainly a big issue. According to the Centers for Disease Control, each year in the U.S. there are more than 100,000 deaths from drug overdoses. Many of these involve opioids. To get the course started, we'll begin with a sort of thumbnail history of opioids and where they come from and what they do, and what kinds of choices have been made over the years that got us into this mess. We'll also do some introduction of basic ethical systems and theories and how they get applied. Then we'll look at how opioids have been marketed and prescribed in the United States. Who knew about the dangers and what did they do about it? We'll look particularly at OxyContin, a drug made and marketed by Purdue Pharma, and all of the lawsuits that has ended up. Some of the ethical issues involved with opioids go back to the fundamental concepts. For instance, how should we think about addictions or substance use disorders? Are these diseases to be treated, or is this bad behavior to be punished? Also, opioids are typically used to treat pain, and there is some surprising cultural and even political factors that influence our judgments about who is in pain and whether they deserve that pain and how that pain ought to be treated. It's fascinating to look at what's going on under the hood there. Next, we'll look at some of the ethical issues that come up when we try to treat an opioid addiction. There are problems with access to treatment. What are the laws and policies and ethical issues involved there? Also, sometimes these addictions have court-ordered treatment. How does that go, and is it really effective? Do the usual standards for consenting to treatment and refusing treatment really apply? How should we look at this ethically? The opioid epidemic is something that we still have lots of unanswered questions about, so lots of research needs to be done. But this raises ethical questions too. Some of the research is going to be public health epidemiological research. That is, we need to find out where the epidemic is and who's involved and how it spreads. And this typically means doing surveillance. But doing surveillance of drug use is something that's tremendously sensitive. How do we do that without violating people's privacy? Also, how do you set up an ethical study to look at the effectiveness of a treatment for opioid use? If our current laws and policies about the use of opioids were effective, we wouldn't be in this mess. So what went wrong and what should we do differently? And what are the ethical issues involved? So for instance, we've got harm reduction measures such as supervised injection sites. Some people say that these are life-saving. Other people say that they're promoting and normalizing addiction. How do we do an ethical analysis of that? We've also been in the so-called war on drugs for decades now. How's it going? Is anybody winning? What are the ethical issues involved with legalizing or at least decriminalizing certain drugs? Here's what you would do for a grade in this class. Early on, there'll be a few short quizzes. Then there'll be a number of discussion topics where you post your comments and responses to discussion forums, right? I'll pose a question or present an issue and ask people's feedback on this. There'll be a midterm exam, which is two sort of take-home essay questions, and there'll be a term paper. The term paper will take in stages. I'll do reviews at various points for helping you select a topic and do an outline and do a first draft of your ethical analysis. You'll have lots of helping hands along the way with the paper. Notice that although this is a 4,000/5,000 level course, there are no prerequisites. I'm not expecting you to have taken any classes in philosophy or pharmacology or anything like that. Furthermore, if you need more upper division credits to meet your graduation requirements, this is a good way to get them. Another important feature of this class is that it's completely online and it's asynchronous. That means that there's no particular day or time when you have to be logged in. That means that it will fit almost any schedule. And our big bonus is that there's no required textbook for this course. That saves you probably about $200. You're welcome. Finally, I want to point out that this class would count towards a certificate in biomedical ethics if you decide you want to add that to your degree. This is something that you can do either at the graduate or undergraduate level. The undergraduate degree is just 12 credits, 4 courses. This is one of the approved electives. Here's a quick list of the 3 other courses you would need to take. Maybe you've already taken some of those. At any rate, a certificate in biomedical ethics might be a nice way to set yourself apart from other job applicants if you're headed into a healthcare field. If you have any questions, please feel free to get in touch with me, and consider this when you're setting up your spring schedule.